Hi students, welcome to the next video in oral pathology. We are discussing bone lesions. So usually benign bone tumors, they don't ask you in any much questions, but there is one or two entities that is little confusing and they have asked that question. Okay, so I just want you to clear the concept in that areas. Okay, so in benign bone tumors, I would like to discuss three bone tumors. Okay, so first one is your osteoma. So osteomas are benign bone tumors. Okay, benign bone tumors, and this is nothing but a benign tumor that is arising from your osteoblast. Okay, so osteoblast is causing this benign bone tumor, and it can come either in the surface of the bone or within the center of the bone. Okay, so if it is comes the surface of the bone, it is it's called a periosteal, and if it is coming inside the bone, it is called endosteal. Okay, periosteal means the osteomas comes on the surface. Osteoma on surface of bone. And if the osteoma within comes within the medullary cavity, okay, then we call endosteal. Okay, medullary cavity. And what is this there in the osteoma? It is nothing but a mature bone. Osteoma comprises nothing but a mature bone tissue. And in the radiograph, what you see in the radiograph, you see radio opacity, nothing else. You see nothing else in radio opacity other than radio opacity. In histopathology, you just see mature bone. Okay, simple mature bone and lot of osteoblast. Okay, so this is what you see in an osteoma. Now there are certain concepts and questions regarding that. Which is the most common site for osteoma in the jaw region? Okay, the most common site, okay, most common site for this osteoma, and that is nothing but your body of the mandible. Okay, body of mandible is very favorite site for the osteomas. Okay, body of mandible, and then comes second most common site is your TMJ. Okay, TMJ. Body of the mandible is a favorite site for the osteoma, and the other thing that the syndromes associated with osteoma, you may know, you have the Gardner syndrome, right? Gardner syndrome. The Gardner syndrome, where you have multiple osteomas, multiple supernumerary teeth, multiple impacted teeth, all these stuff are there. Okay, so this is about osteoma, and two more things are there. There are two other benign tumors, and we have to compare it and study. Okay, so that is called, one is called osteoblastoma and osteoid osteoma. So one benign lesion was osteoma. The other two benign lesions are, one is osteoblastoma and osteoid. So these terms will look very confusing to you, right? Osteoma, osteoblastoma. So what is the difference between all these? Okay, you understand osteoma. Now let's see what is osteoblastoma. Osteoblastoma is also a benign tumor of your bone, benign tumor of your osteoblast. Okay. Similarly, osteoid is also a benign tumor of your osteoblast. Now, what is the main difference here is that clinical features, and they have asked question in this clinical features. Okay, so the patient coming to you, a patient is coming to you with pain. Okay, with pain in the jaw region, and when you are taking a radiograph, you are seeing a radiolucent lesion with the patchy radio opacity in the mandible region. Okay, the mandible region, what you are seeing, a radiolucent lesion with a patchy radio opacity, and the patient is complaining about pain. Now what you do is that you give NSAID, non-steroid anti-inflammatory. You give NSAID. Okay, and there's no relief. And the size of the lesion is usually more than 1.5 centimeter. Now there is another patient who is coming. He too is having pain. Okay, he too is having pain, and you take the radiograph. You are seeing radio opacity. Okay, with the central radiolucency is there. Okay, so this is what you see, and the radiolucency with the central radio opacity. radio opacity. It is a radiolucent lesion with in the center there is radio opacity. Similar to it. The radiographs looks more or less similar, but here also there is pain for the patient. Okay, and size here it is less than 1.5 centimeters, and you give NSAID, there is relief from pain. Okay, so this is the main difference between osteoblastoma and osteodosteoma. Very simple. Both are tumors, benign tumors of your osteoblast. Now see, both have pain. Both will have a similar radiolucent radiopaque radiograph. Okay, both will have a size. One has a size of greater than 1.5 centimeter in osteoblastoma, less than 1.5 centimeter in osteodosteoma, and the pain is relieved on NSAIDs in osteodosteoma. Okay, so this is the main difference between these two, and this is a very interesting, very favorite MCQ for your NEET, because they want you to know the concept of this. Okay, this difference they want you to be knowing. Okay, so that's about your benign tumors and its concepts. See you in the next video with the new topic.